Or we go to New Haven, Connecticut, where we're joined by Alison Galvani, director of the Center for Infectious Disease Modeling and Analysis at Yale School of Public Health. She's the lead author of the new medical journal Lancet study called Improving the Prognosis of Healthcare in the USA.
On the one hand, Medicare for All will increase taxes for households and employers. I think the important point is that overall it will reduce costs for both the taxpayer, households, as well as the employer. Because it will eliminate the even higher costs of healthcare premiums paid by individuals and employers. It will also eliminate pharmaceutical prices, deductibles, co-pays, and all these other fees. Medicare for All would save over $450 billion compared to what the country is paying now. So right now, the U.S. is paying more than any other country for health care, yet we don't even rank in the top 30 for some key public health measures, including infant mortality and overall life expectancy. And at the same time, there's over 80 million people without adequate health insurance, so either without any health insurance or without health insurance that they can afford. And the Medicare for All Act identifies a number of ways in which it's going to save the country money. So firstly, what people pay right now for hospital services doesn't correlate with their outcomes, their clinical outcomes, and it varies widely. So by applying Medicare rates to the entire country, that will save us $100 billion right there. Another important point is that Medicare for All will minimize paperwork and will streamline administration and billing. So currently, Medicare has an overhead of 2.2%, whereas private insurance is over 12%. So applying Medicare overhead to the entire country will save us $200 billion. If we strip away the savings identified in Medicare for All, and expanded health care through the Medicare for All Who Want It plan, we'd still have all these private entities, and we'd be continuing the inefficiencies that makes our healthcare system so expensive. So on the one hand, I would support the offering health care to everyone in the country. That's paramount. On the other hand, Medicare for All Who Want It, it sounds good, but it's a very expensive way to achieve it rather than the single-payer plan that's being proposed in the Medicare for All Act. Well, the premise of the first part of that statement, I think, is a pervasive misconception. People would have more choice. Everyone would have more choice, because with Medicare for All, there would be no distinction between out-of-network and in-network barriers. So not only would you be able to keep your doctor, if there was a different doctor you preferred, you would be able to switch. Medicare system gives us a real-world test of viability. It succeeded for 54 years, so more than half a century. It has high popularity, bipartisan popularity, and if Medicare can succeed in the age cohort that is the elderly, 65 and above, who access health care most often, if it can succeed in that age cohort, is all the more feasible and cost-effective to be offered to everyone. Virtually every other industrialized country and many that are lower and middle-income countries offer universal health care. For instance, Costa Rica has a per capita GDP that's about 1/5 ours per capita, and they have universal health care. For the last 30 years, they have had a higher life expectancy than the U.S.